Good morning, guys. Welcome back to MedLife. In the past few videos, we talked about the introduction to MBBS first year. In this video, we're going to talk about the introduction to human anatomy. As we said, anatomy has three major parts: gross anatomy, human embryology, and histology. So what we're talking about is gross anatomy. So there are many new terms that you will learn in anatomy that you have not heard of them before in your normal routine life. So, and you need to memorize these terms in MBBS. So let's start with the anatomical terms. Okay. If we imagine I'm standing in an anatomical position. This is how you stand in an anatomical position. Straight upright, your hands are open like this, and this is perfect anatomical position. Okay, now, if we imagine an imaginary line that passes through this place, and we call that the midline of the body. This is our midline of the body. As we come closer to the midline of the body, from the other side we come closer, we call this medial. And as we go far away from the midline of the body, we call that lateral. Lateral, medial. Closer would be medial, and far would be lateral. And up, which is high, up above something, is called superior, and below and down is called inferior. Front is called anterior, and back is called posterior. So basically, I'm standing anterior to the wall, in front of the wall, and the wall is posterior to me. And now, your anatomical positions and their terminology. You're standing here and you're moving. Imagine I'm moving my arm forward. I'm extending my arm, moving away from the body, I'm extending my arm. This is called extension. Now I'm bringing it back to the body, from far to the body. This is called flexion. I'm flexing my arm. And now from this side, if I take it laterally far to the midline of the body, I'm taking it far away from myself. This is abduction. In this direction. If I bring it forward, this is extension. And if I bring it backwards, this is flexion. And if I bring it on this side to the lateral side of the body, like this is abduction. And I bring it back to the body, to the medial side, closer to the midline of the body. This is adduction. Adduction, extension, flexion. Now, let's talk about some little parts of your body. Let's start with muscle. What is a muscle? Probably you've heard of it a lot. I've gained a lot of muscle. I'm very strong. I have a lot of strong muscles. So basically a muscle is a tissue. I've explained tissue in the previous videos. If you haven't watched, go watch the previous videos. So muscle is a tissue that gives shape to your body. Like all of this thing you see on your face, in your body, all of these meats that you think you have, they're all muscles. They give shape to your body. So muscles have three main categories: skeletal muscle, smooth muscle, and cardiac muscle. They're all different, their histology is different. We'll talk about that later in the histology. Now, let's talk about bone. What is a bone? A bone is a very dense connective tissue that gives structure to your body, that is strong and makes you stand, make your body stand. Like, if you only have muscles, you can't stand. But muscles can go down, you can stretch the muscles. But the bones are very strong, they're very dense connective tissue, and they're very strong to give you structures of your body. You're standing, It's majorly because of your bones. Those muscles that I've talked about them before are attached to the bone. Now, what's a tendon? A tendon is what connects a muscle to a bone. Your muscles are connected to your bones by a tendon. What is a ligament? A ligament is what connects a bone to another bone. For example, your shoulder bone, which is called the scapula, is connected to your arm bone, which is called the humerus, by some ligaments. A ligament is what connects a bone to another bone. Now, a very interesting thing. What are blood vessels? So basically, blood vessels are what transmit your blood throughout your body or takes them back to the heart. Blood vessels have three types: capillaries, arteries, and veins. Capillaries are the smallest and tiniest types of blood vessels. The blood vessels you see in the retina of your eye are capillaries. Arteries are blood vessels that get blood from your heart, which is called the oxygenated blood. It's pure blood and oxygenated, and they take it to all over your body, to different organs, to your limbs, to your head and neck, to every part of your body, from heart to the parts of your body, and the blood is oxygenated. And veins are the opposite. They take deoxygenated blood from the parts of your body to the heart. And the last point to mention over here is anatomy has divided the body into different parts. Let's start with the first part, from superior to inferior. They're divided into head and neck. Starts from your head and to your neck. This is called the head and neck part. From there, you have your upper limb, your hand, your forearm, your arm, your shoulder, your chest. The chest is very basic muscles like pectoralis major. There is a muscle that covers your chest, only until that. And your arm, your forearm, your hand, your fingers, they are all your upper limbs. From there, they're divided down into thorax. From down inferior, from your neck until to the superior to your abdomen. This is called thorax. In this part, you have the lungs, you have the heart, and the thing that comes here. From there, inferior to your thorax, you have abdomen. Abdomen is where you have your stomach, where you have your intestines, and until this part is completely abdomen. Down from abdomen, inferior to abdomen, you have the pelvis. The pelvis is where the reproductive system comes and the reproductive organs come and things related to that. So anatomists have divided your body to different anatomical names and parts so that they can be able to study easier. Thank you guys for watching. If you like this video, please like, share and subscribe to the channel.